name is Aletha Jones, and this video is for partial fulfillment of the requirements for course 5309, Teaching, Learning Theory, Strategies, and Evaluation in the Master's of Science in Nursing Education program at the University of Texas at Arlington's College of Nursing and Health Innovations. All participants have agreed to the publication of this video. Role-playing is a way of projecting oneself into the future in a what-if scenario. Although in the classroom setting the outcomes can be controlled, this teaching learning strategy can be a very flexible and effective learning tool. Role-playing is a rehearsal for the future that focuses on giving situations that contain different viewpoints or perspectives. The goal of this scenario is to give pre-nursing students a glimpse of unethical behaviors that can occur and to initiate the thought process of what professionalism means.
What is it?
Nurse.
What do you mean you don't feel well?
I'm feeling really strange. I'm not sure what it is.
Here we go again. Didn't you just leave the hospital yesterday? He keeps coming back for the same complaint over and over.
Well, we keep coming back because apparently you idiots don't know what you're doing.
Isn't that just typical?
Nurse Ratchet, is there something wrong with it? I feel really upset.
Is something wrong? I'll tell you what's wrong. I've been working long, hard work in hours, and nobody appreciates the nurses at all. I'm just so tired of this. Did you ever offer and consider my feelings, how I'm feeling today?
This is ridiculous. We do not deserve this kind of treatment. I want you out of this room right now, right this second, and I will be speaking to your manager. Thank you. Goodbye.
Fine.
Fine.
Okay, students. Now, let's talk about the communication skills here. How do you feel that these communication skills were?
They were very poor. The nurse, she didn't show any compassion nor concern towards the patient nor the patient's family member. She was more or less concerned about herself, and she was just rude.
Okay. And how does that make you feel as a future nurse?
That I don't want to be that type of nurse. I want my patients to know that I do care about them and their health, and that I'm here for them to provide a service. And I want the family members to also know that I have concern for their loved ones, that their loved ones is left in good hands.
That is a very good thought process. Okay, Miss Kathy, do you feel that this may have been some type of psychological abuse, and can you give your rationale for that?
Yeah, it could be considered psychological abuse. The nurse did not consider the patient at all. Now granted, things do go wrong, and a nurse might not be in the best of frame of mind herself, but she should never, or he should never, let that impact a patient's care. So she didn't even inquire as to what the patient was upset about. So not only was it psychological, it was bad nursing practice.
Well, thank you for that. And how does that make you feel as a future nurse?
Angry. I'm angry at her because that is not the profile of a nurse. In my mind, a nurse is, as Sheila said, compassionate, caring, and really want to do their best for the patient.
Well, thank you, young ladies. I'm glad you were here today and could participate in this project. Nurse educators can use role-playing in order to help students learn helpful ways to relate to patients, other students, and to actually see how negative situations impact their profession. Role-playing also assists with changing attitudes. When students are able to play the patient, the learner role, or spectator, they become more sensitized to aspects of behaviors, thoughts, and feelings that they may have never been conscious of before. And that concludes this learning teaching strategy. I would like to thank all of the participants for this assistance and willingness to learn. Thank you.